Hi, my name is Dr. Mark Siefkies with Eye Associates, and today I'm going to talk to you about options for people who need reading help and would like to accomplish that with contact lenses. With contact lenses, there's really three options for people who've reached that point in life that we all get to, early 40s, who need to have distance help but also need reading help up close. And the first option is to just keep people in distance contact lenses and then wear reading glasses for their up close. You know, at Eye Associates, we think that's probably the least attractive option. It's not as convenient. You're on and off with reading glasses all day long. You can never find them when you need them, so really not the most convenient option for people. The other two options, and what we recommend for most of our patients, are either monovision or multifocal contact lenses. And monovision lenses are very common, have been around for a very long time, and really what that is, it's simply where we manipulate or change the power to have one eye with regular contact lenses for far distance and the other eye for up close reading. And works pretty well for most people. You know, it's not an option that's for every person, but for most people, once they're able to get used to it, which takes a week or so, it's a really nice option because it allows that person to wear contact lenses and have good distance vision and good up close reading vision without purchasing or putting on reading glasses. The other option is to do a multifocal contact lens. And this is a lens that, instead of being just a distance-only power, has both distance and reading power in the same lens. And they work a little bit different than bifocal or multifocal glasses. A multifocal eyeglass has distance through the top, and then intermediate and reading as you gradually look down through that lens. You can't design a multifocal contact lens that way. These lenses, they're designed with what's called a concentric design. You have rings of power. You can think of it like a bullseye pattern. So you have a ring of distance, ring of near, ring of distance, kind of out to the periphery of the lens. And the way then that lens works is it gives the person both their distance power and their reading power all at once, and then the person's visual system figures out which of those to pay attention to at the appropriate time. Again, takes some getting used to, but once people get used to it, it's a pretty natural setup, and we tend to lean towards that as our first choice for people who, again, have that distance and reading need. And the reason being is it allows for both eyes to have distance vision and both eyes to have reading vision up close. So it's a bit more natural, kind of what we're used to before we reach that early 40s change where our eyes don't focus as well up close. So those are the two main options that we offer and fit really all the time. And yeah, I think the really interesting thing is most people, most patients, aren't really aware of what their options are when it comes to contact lenses. You know, there's a lot of people that have never needed glasses at all. They've had great distance vision and great up-close vision their whole life, and now they reach that point where they need some reading help early 40s, and they think, well, my option is to just go ahead and put on reading glasses, and that gets very cumbersome and very inconvenient over time. But they're not aware that there's even options in contact lenses. And for that person who's always had good distance vision, one really nice choice is just to wear one contact lens. They can put a lens on one eye, and that gives that eye the reading help it needs, and the other eye wears no contact lens, and it has the distance help. And in that, again, setup of monovision is very convenient. People love the fact that they don't have to put on the reading glasses on and off 100 times a day. So that's a really nice option for that person. But I think it's important to know what your options are, and that's what we strive to do here at Eye Associates, is to educate people on what's available to them. And there's countless times where I've talked to patients of mine where they're not even aware of multifocal contact lenses. And a lot of people really like the convenience, the freedom, the flexibility that they offer. So if that's something that people have an interest in, we're certainly well versed here at Eye Associates to help them through that process and have success and very possibly not need glasses for their up-close needs. You know, a lot of folks have been in contacts, they love to stay in contact lenses, and they're unsure if that's going to be a possibility when they reach that early 40s part of their life. And so, you know, it's something that we're certainly able to help people with, and we have a lot of happy patients that really enjoy the fact that they don't have to rely on reading glasses or